a new, what we can say, way now, but by using amino acid formula with other, what we can say, symbiotics. Like you add the benefit of the microbiota to add it to the amino acid formula. And the idea behind this point that will give the benefit of amino acid formula plus the benefit of the symbiotics together. And what will be the result for the patient? At least if not the same, you are giving more benefit, more advantage for those kids. If you go also to the literature, for example, it's one of the studies, it is a retrospective match cohort study, the Health Improvement Network. This is the old thing. Among around 3,500 kids, they choose 148 infant and divided to two halves. One, they give him amino acid formula with a symbiotic containing the bifidobacterium and M16 Chiari prebiotics, and the other half, it's only amino acid formula, the regular one, the standard, without any symbiotic. And they do the characteristics of all these groups. They found it almost similar. They put the exclusion criteria, severe comorbidity, or use of other specialized formulas. For those, they need other formula. The primary outcome was incidence and rate of clinical symptoms: GI, skin, respiratory, infection, GI, skin, and respiratory, ear, medication prescription, antibiotics, dermatological anti-reflux, healthcare usage, dietitian visits, hospitalization, and referral. All of this, they put it as a primary outcome. Time to asymptomatic management without hypoallergic formula, defined more than 3 months without symptoms or formula. And they do the statistical analysis to also to consider the cost analysis. And this is what we'll see in the result. They found, in comparison, those with symbiotic, 2.43 person per year, the symptoms. That mean the one without symbiotic, they have more symptoms, more complaining, with a p-value, significant p-value. The infection, it's decreased 1.82 per person, those with the symbiotic, in comparison to around 3 with those without symbiotic. Allergic symptoms, GI, skin, respiratory, almost the same, that not have a big difference. Respiratory infection, they found around, with those with symbiotic, around 60%, and with those without symbiotic, around 85%. They continue the comparing. Most of the elements you see, medication prescription, using of antibiotics, need to use emollient to relieve the dermatological symptoms, dietitian visits and contact. All with those using and hospital admission was no significant difference between them. All of these other elements, they found it the upper hand for the using amino acid with the symbiotic. To reach to conclusion, amino acid formula with symbiotic was associated with fewer clinical symptoms and infection, reduced medication use and healthcare contact, area resolution of symptoms requiring formula by around 7.2 months, potential cost saving to the healthcare system. Your patient not admitted to the hospital, your patient not receiving out of antibiotics, your patient not get sick, your patient not need to be visit dietitian further than the others one. For all of these, it's affecting the cost of each one of your patients. Actually, in the literature, a lot of comparing studies, and a lot of them, it's very promising. And as I think in the future, we'll see a lot of big scale studies, which I think it have a role. Here now, again, just to think about, I'm using the amino acid formula with a symbiotic. I expect the patient skin manifestation to get improved faster than those with only amino acid formula. The infection number and attacks and episodes become less for those they are prone. But here we are not talking about with those having primary immune deficiency or short bowel syndrome, or extreme breather. With those category, they have a contraindication to start symbiotics. I'm talking about a normal population with cow milk protein allergy and IgE mediated. So I think it's the era coming, and the symbiotic will have a good impact on those kids. In the end,